This is the True Leader Podcast. Today, our special guest is healthcare executive Terry Shoulder. We talk about her new book and discuss how hospital executives and board members can create and sustain excellent care. Stay tuned.
Welcome to the True Leader Podcast. I'm Dr. Tracy Christofferson.
And I'm Michelle Trosett.
We are life and business besties, leadership coaches and mentors, and polarity intelligence experts. We're the authors of Polarity Intelligence, The Missing Logic in Leadership, and co-founders of Missing Logic.
We are here to help high-achieving leaders break through leadership norms that cause them suffering at work and home. If you're looking to elevate your leadership, increasing your productivity, effectiveness, and impact, and manage your health and well-being, spend quality time with those you love, and live your best life, then you are in the right place.
Our goal in this podcast is to equip you with new ways of thinking and practical and tactical strategies for succeeding at work and thriving in life. Think of this podcast as your weekly dose of personal and professional development so you can reach your full leadership potential, create a life you love, and be what we are calling a thriving, resilient, and unstoppable or true leader.
If you are ready to learn and laugh a little, let's get started. Well, hello, everyone. Welcome to another episode of the True Leader Podcast with Michelle and Tracy.
Here we are. We are so happy to be here, as we are every single episode.
Every week.
All the time. You know, like how special are we?
I know.
We get to show up here in the studio, meet great people, laugh, talk about awesome things.
And you're all at home saying, it's Wednesday. It's time for Michelle and Tracy.
It's the Michelle and Tracy show. Oh, no, I mean the True Leader Podcast. Well, whatever you're saying, we know it's good.
That's right. Oh, gosh. Well, today we had a great interview with a healthcare executive leader with a lot of experience. And, you know, I just really applaud that she's just taken her work and she's moving it forward in her own way.
Yeah, she is. She reminds me a lot of us. Maybe that's why we appreciate her. Well, she just really, you know, she has put together something that is very powerful and very effective, and she's committed to helping healthcare organizations implement it and, you know, get sustainable outcomes. And, you know, she's seen some patterns and we've seen some patterns, and she's like busting through that pattern. She wants to make it happen, and she's going to do whatever it takes, I think, to make that happen. So I love that about her.
I did too. She's bringing her wisdom to different places and experience in a way that she couldn't do if she was at a organization. So she found a way to bring it to many.
Yeah. So it's really great. And who we're talking about, of course, is Terry Shoulder. So let me tell you a little bit more about Terry. She is a distinguished healthcare nurse executive with nearly 2 decades of experience in leading quality, patient safety, and utilization management. Starting her career as a nurse, Terry quickly advanced into executive roles, leveraging her clinical expertise to improve health system quality and operations. As a founder of Shoulder Healthcare Consulting, she specializes in length of stay reduction and enhancing health system-owned home health capture rates through the trademarked Smart Transitions model, implemented in hospitals across several states. Terry combines her extensive leadership experience, clinical knowledge, and coding proficiency to drive clinical and operational excellence. Nationally, she's recognized for her ability to craft sustainable solutions, and she integrates cultural nuances and evidence-based practices to optimize processes, creating high-quality, efficient, and cost-effective framework for clinical excellence. You go, Terry. Through her innovative approaches, Terry continues to help health systems achieve aspirational goals, ensuring improved patient outcomes and streamlined operations. And every healthcare system needs that.
Yes.
So, without further ado, here is our incredible interview with Terry Shoulder. Well, welcome, Terry. What an exciting day to have you here with us. Welcome to the show.
Thank you. It's quite an honor. I'm very happy to be here.
Oh, well, we're really happy to have you here.
Looking forward to the conversation this morning.
Yeah. And we want to welcome you to entrepreneurship. Woohoo! Big leap there, sister.
It sure is.
Well, you're not alone. You're not alone. We've made the leap as well. And we were just really curious. You've had, quite a leadership journey, and we just wondered what kind of led you to make this significant change and not just continue with another leadership role in an organization, but really to start your own.
You know, I started. My first thought is, oh, it was a tough decision, but it really wasn't. I would say it was probably a pretty easy decision. I loved my role in the C-suite. So for the past almost 2 decades, I was a chief quality officer for large health systems and then a multi-state home health agency. My passion for leadership equals my passion for improving patient care. And we all know that leadership is hard. And although it's incredibly rewarding, it's also time consuming. With consulting, I no longer have a team of 300 individuals to lead, which, I definitely will miss because I really do love leadership. But I figured I could take all of the best parts of what I learned about process improvement, about working and engaging boards, and focus my time and efforts on solutions that I know work. The solutions that I've discovered over my career, not only solve complex issues, but also empower clients with the knowledge and the ability to sustain performance. And so just with opportunities that I had to conversations with healthcare leaders, I just identified a real knowledge gap on how to truly drive performance improvement. And another thing that's really interesting, I returned to a hospital as a consultant where several years ago I had worked. I served as their chief quality officer. And during that time, I designed an effective, with the help of my team, obviously, a very effective care coordination model. Now that we call it proactive care transitions. It reduced length of stay drastically, just below the geometric mean, which is not an easy feat. So that saved the organization millions of dollars. However, after I left, leaders came and went, and eventually the model that we had put in place was changed, forgotten. And so 6 years later, I found myself in a meeting with leaders of the same health system discussing their current length of stay problems. And really, that whole experience highlighted, or I guess reinforced for me, the importance of these leaders knowing what drives desired outcomes so that the processes that work can be maintained or improved upon over time, but not dismantled and not forgotten. I love the logical approach to your podcast, because in this case, logic dictates that when performance improves or you meet a goal, if you cannot say what change that led to that improvement, your chances of sustaining the success are pretty slim. And so, with that, I designed the consulting company to be a little different than other consulting companies, where we come in, we devise a strategy, we develop a plan, but then we stick around for implementation and results, because the implementation is the hard part. And it's so funny, I said logic dictates. I have my Star Trek mug here. Oh.
Well, we can certainly relate to your journey. We've had the same kind of journey, where you do incredible work, you get incredible results, leadership changes, right? And everything gets diluted over time. Everybody brings in their own unique flavor when at the heart, right, that if you just sustain those structures, those processes, you'll continue to get, sustainable results. But we all got to put our own spin on things.
Yeah, and it is very difficult, because everyone that comes into a well, for not everyone, I shouldn't overgeneralize, but you come into a leadership position and you want to prove yourself. You want to leave your mark, but sometimes, unfortunately, that, like I say, things are dismantled that were actually working. So
yeah, we can relate. Or there's things that work together for a reason. They think, well, we don't need that part. We'll just take that part out, and they don't realize what a critical element that was for the overall transformation and sustainability. To your point.
Well, then
Oh,
for those that
likely.
are in the organization that value the process, then we have what you call the here we go again file, where you're trying to redemonstrate the need and the value for what has been, right? And why it's there and what you've gotten from it. And so we pulled out the here we go again file multiple
More than once.
times.
Yeah, a little bang in the head against the wall goes on there, doesn't it?
Yeah, for sure, for sure.
It does.
Well, Terry, congratulations on your new book. We're so excited for you. It's called Ascent to Excellence, a blueprint for healthcare board and leadership success. So tell our listeners what prompted you to write the book.
Well, so throughout my career, I've witnessed the challenges that leaders face in maintaining these successful achievements, just like we were talking about, especially with those frequent changes in leadership and what we know is very short institutional memory. And so the inspiration for writing it was initially to document a proven framework for achieving amazing success across most health system KPIs, including operational metrics. So the blueprint was used to drive a Midwest health system to a top 15 health system for at least 3 consecutive years, up through 15. I left in 16. Also worked to take a large health system from the 25th percentile in the nation to top decile. And again, for a multi-state home health company from 3.5 stars to 4.5 stars. So my thoughts were, I really need to capture this somehow. We need to document this because, it's just such a proven methodology. And I also wanted to provide a guide that board members and leaders can rely on to understand what are those fundamental drivers of success. So what I did with the book is and when I first started writing it, it was interesting. I was listening to a podcast actually, and about just entrepreneurship and how to get started. And one of the recommendations that the host gave was, hey, just write a book, write the worst book on the planet. Because I couldn't, like I said, I couldn't get past the first line. Do I make it first person? Do I make it third person? It's horrible. Anyway, so I took that advice and all of a sudden it started to evolve into these evidence-based strategies that I had employed over the years. And I thought, wow, this one could really help leaders not only achieve excellence, but sustain it, which is really, what was key. So by memorializing it in blueprint format, my hope is that I can empower these leaders with that knowledge that they need because, we know even coming out of COVID, these health systems are struggling financially. And we all know what happens. We're all clinicians. We know what happens when health systems struggle financially. Mm-hmm. Quality can take a back seat, and we cannot let that happen. So, with this blueprint, it'll give organizations the ability to recover, like cost containment initiatives as well as revenue generating, so that we can get back to, hey, we've got to prioritize quality because that's why we're in this business.
Yeah. Well, and that's one of the key polarities that organizations deal with, the cost and quality polarity, right? It's not about either or. And if they overemphasize one, to your point, and neglect the other, then there's consequences to pay for that, right? So over time, you're gonna get unintended consequences, not what you're looking to achieve, even though you might initially experience some success, right, or some achievement of towards your goal. And we totally agree with you when it comes to a blueprint, because we know, like, when you can make something really concrete, give them the step-by-step, right? These are all the elements that you need to consider. Just is so helpful. And we've done that with the work that we've done with leaders too. And we created a dynamic balance blueprint to help leaders really create, thriving personal lives and excel in their professional lives, get that balance between the two. And so there's really 5 essential elements in your blueprint that you represent in the book, kind of 5 key elements. So tell our audience, if you can, just a little bit about each of those elements so they have a sense of what makes up this blueprint.
Okay. Yeah, absolutely. So I'd be happy to share an overview. So first of all, one of the things that's most important is leadership commitment to the goal. Leaders have to walk the talk. And that element, the reason it's first in the book is that it emphasizes the importance of leaders being fully committed to the organization's goals. So, not only setting clear objectives, but also leading by example, demonstrating their dedication through their actions. And that commitment builds trust. It inspires the entire organization to align with the vision. And I can give an example of where there really wasn't clear communication. I was working with a team in a health plan. And the goal was to narrow the network of post-acute providers based on their quality. So as I was generating the strategic deck with the objectives, I had the words, narrow the network, establish quality criteria to narrow the network. And one of the leaders spoke up and said, "Oh, we don't want to put that in there because other people might see this." Okay. And so what that told me right away is that the president who established this goal to narrow this network had not communicated effectively to all of the leaders in the organization. And the thought around that was, just to kind of complete that thought, was that by narrowing the network, the people who are working on home health may get all upset because, what about capacity? We have to have enough of them, et cetera, et cetera. So anyway, that's really why that's the first and really critical element in these 5 elements, is that leaders need to be committed and verbalize that commitment throughout the organization.
Yeah. Well, and it's kind of like, too, you got to take a stand behind what you want, what you're asking them to do, right? So if you have fears of putting things out there, right, then how much of a stand are you taking behind what you're asking people to do?
Mm-hmm. Mm-hmm.
Mm-hmm.
Yeah,
that's true. And then the next is data integrity. So reliable and accurate data is the cornerstone of effective decision making. And by maintaining really high standards of data integrity, that helps organizations make informed decisions that drive continuous improvement. Now, the problem that a lot of organizations face with data integrity is that data is coming pretty much from physician documentation. And so if your physicians are not using natural language processing or in a hurry with large caseloads, you're not going to have the specificity that you need. And so, that's with data integrity. I'm always, I'm a big fan of clinical documentation improvement programs, and really it is critical in capturing that specificity needed for coding, so that you can reflect accurate risk adjustment. And another thing with the data too is making sure that you're benchmarking against reliable sources. It isn't just, if you benchmark, say, to CMS Compare, keep in mind that you're benchmarking yourself to average, because that's those are the benchmarks that are on CMS Compare. And so, most people want to be a little better than average. Anyway, just understanding your data, understanding benchmarks is really important. And then the third is workforce engagement. And that's kind of self-explanatory, as we know. But one thing that's really important with workforce engagement is that I promise you, it is the president or the top seat in the organization that's going to set the tone for engagement. They have to really foster a culture where employees feel valued, empowered, involved. Is one thing I put in the book that I thought was such a cool example of there was a hurricane coming to Florida, very near this hospital system's flagship hospital, and didn't know whether it was going to be a direct hit. It was actually Hurricane Irma. Didn't know if it was going to be a direct hit or not. So this health system issued paychecks a week early for all of their staff, 30-some thousand employees, just so that they would be prepared and equipped financially if the health system did get a direct hit. That's engagement. I mean, that's how you earn the trust of your people. So
right.
Yeah.
Got their backs. They need to know that.
Yeah. And then process optimization. So a poor outcome is the byproduct of a faulty process. And I would say the most difficult mountain to move in healthcare is changing behavior. And process change requires behavior change. And the best quote for performance improvement specialist is that definition of insanity. keep doing things the same way and expect different outcomes. But we do, don't we? We say, oh, here, let's look at this data, and then we walk out of the room and we get back to the fires and the day-to-day stuff. It takes a lot of time to change behavior. And really getting back to that question about consulting is that realization combined with the knowledge that leaders don't have time to do this, I thought, would set us up to provide a service that would be, very beneficial to health systems and hospitals. Oh, and then the last one. So cadence of accountability is the last one, or a culture of accountability. Having a regular bedside to boardroom cadence of accountability ensures that everyone in the organization is held responsible for their performance. Just making sure that the goals that are set are clear, and expectations are clear, progress is being monitored, feedback being given. And so that consistent accountability framework is really the fuel that feeds and accelerates results. I know earlier in my career, when I was just getting into management, the organization had goals, not necessarily that resonated with the staff, and that's another thing. Those goals need to resonate with your workforce. But at the staff level, the staff would make up their own goals. All right, set 3 goals. Well, okay, I'm going to get my bachelor's degree. I'm going to get my CPHQ certification. But those goals didn't connect at all with the organization's goals. And so by having that cadence of accountability where goals are clear, and from the front line all the way to the C-suite, the goals are aligned with the organization's goals. It's just really is a very effective mechanism to drive results.
Yeah. Yeah. We did a lot with that when we worked in healthcare with what we called partnership councils. So we really aligned what the unit structure was doing in relationship to goals to, align to like central goals around the different units, and then all the way up to the organizational goals. And it takes great intention, but it also helps with that engagement piece where everybody sees how they are contributing, how they have a part in the success of the organization and moving things forward.
They would have goal setting sessions, for like 4 hours or a day. And the other thing that was really unique that helped with the alignment too is it wasn't just the frontline staff. It was the director, the other roles, education, clinical specialists, everyone that mirrored that department or unit was a part of that as well.
There's something to be said for feeling like you're a part of something bigger than yourself.
Yeah.
And I can say that with consulting, being the person who, can't insist but can only recommend, that is the part that I'm going to miss. I'm going to miss that sense of team, because I just had such a great career and just worked with some of the most incredible people.
Yeah. Well, thanks. That's very helpful to hear all of those different key elements. Those are awesome.
Another thing that we really liked about your book is how you talked about healthcare board and governance. And a lot of times you don't think about the significance a board member plays in the big picture. So if you were to say from your experience, Terry, what are 1 or 2 gaps in preparing board members? Because they're often lay people, business people. What are some things we should be thinking about to fill those gaps and preparing them?
So what I've found is hospital boards are typically comprised of some of the sharpest minds in the community. But that doesn't mean that they automatically know how to govern healthcare. So one gap is the assumption that just because a board member is a pillar in the community, they inherently understand their role on the board. It reminds me of very similar to the assumption that the Centers for Medicare and Medicaid Services made when they added medication reconciliation to the physician role instead of a pharmacist. So both are experts in their fields, but the expertise doesn't always translate, and if it did, we wouldn't have pharmacists working directly in these critical care units. Because the reason I use that, analogy is because in a lot of the work that we've done with readmissions, we found that if we have a pharmacist doing the medication reconciliation, there's an 80% less chance of error. But anyway, so I digress. But so I would recommend not only creating new board member orientation to healthcare quality, but also include the board members in annual training on quality assessment and performance improvement. And then another gap really is thinking that more data and more slides make a better presentation or make it more interesting. A lot of these dashboards and presentations are just packed with so much information that even an experienced analyst would need a weekend to decipher it. And so and no one, even these board members, I don't care if you're a president of the biggest bank in the country, no one wants to feel uninformed in a group setting. And so, with information overload, your board members, may be hesitant to engage or ask questions. So a key that I found to helping boards really understand the organization's goals, what's most important, and current performance is a simple yet compelling scorecard that's used the same scorecard, the same format every quarterly meeting. Kind of like a cheat sheet, reinforcing the metrics, reinforcing the benchmarks, and the measurement methods, because you're getting this. They get this pattern recognition, and so they only meet every 3 months, right? Every 4 months, every quarter, and so life goes on, and we see it every day, but they don't. And so the more simplistic you can make that report that you share with the board, the more that pattern recognition is going to help ingrain that information, so they'll understand it better.
Oh yeah, that makes so much sense. And really, you want it to tell the story, right? You want it to tell the story, not just be numbers and data, but really reveal what's happening.
The human element.
Yeah, that human element as well. Yeah. Awesome. Well, those are two really great points. I think the other thing we would add is they need to understand polarities. Yes. Especially when it comes to mission and margin, cost and quality. When you understand the relationship amongst the elements that you are, helping an organization navigate. If you are unipolar in your thinking, you don't have a complete picture. So really understanding the dynamics that are at play and the relationship between these is so, so important for board members. So let's add that to their education as well.
Yeah, what a good thought. Well, and not just there, but even the other executives.
Exactly.
Oh, yes.
She's over quality, so I don't really need to understand. Exactly. Oh, you absolutely do.
Yeah.
If you're a CFO, understanding, the possibilities that this could have, or the impact that it would have on the organization's finances, is very important.
Oh yeah, because that's an interdependent relationship, right? And and you need the best of both. So that's a critical partnership in an organization. Yeah. Well, wow. I can't wait to read the book. So now we get to the mystery questions.
Yes.
Okay.
All right. Now these, don't worry, they're simple questions. They're not difficult. But we just like our listeners to get to know the true you. So we just have a couple of questions to ask you. So the first is being a fellow northern Michigander, like I am, right? Up in the northern part, not way up in the UP, the Upper Peninsula, for those of you who don't know what the UP is. But up in the northern part of the mitten, let's say we want to ask you, what part of M22 do you enjoy the most? What do you like the best about it and why?
I literally have goosebumps from that question. So M22 for the listeners is a road that goes up the western coast of Michigan, of Lake Michigan. Western coast of Michigan, the state of Michigan, and it's absolutely gorgeous. There's not a lot of, it's not touristy. It's natural sand dunes, and Lake Michigan is just beautiful, like crystal blue. But yeah, so I love that part up where you get close to Glen Arbor, which is you just see all the dunes and how the dunes go right down into the water. But I tell you what, there's nothing, I don't think, more beautiful than driving up M22 on that side of the coast in the middle of October.
Oh,
It's
yes.
just gorgeous. I mean, it's yellow and red, and it's just absolutely beautiful. It's breathtaking. But yeah, I just love it. However, though, we don't want any more people up there. So
Yeah. So now you can just take our word for it.
That's right. Actually, I was just thinking we asked a recent guest about Lake Michigan, and she went on, and people listening to our podcast, we're gonna become a Pure Michigan commercial.
Yeah. Well, it's a beautiful place.
it is. And you know what? In 40 years, it hasn't changed that much. Where the rest of our lives is constant change.
Yeah,
But up there, it's just peaceful, and it just hasn't changed that much. Even every town you go in, it's remarkable.
Yeah, that's a great point. That's
great
a great
answer.
point.
See?
Oh.
You had that one.
That's funny.
Yeah.
Well, Terry, with summer comes ice cream. So we, there's nothing like
yeah.
there's.
And a few extra pounds.
We love going out for ice cream in the summer in Michigan too. It's just so much fun. So we were just wondering if you could share with our listeners what your favorite ice cream flavor is.
My favorite ice cream flavor, I'm a vanilla girl.
Oh, wow.
I am. I'm just a vanilla girl. I used to like mint chocolate chip, and then I saw something. I think it was a Scrubs episode where Donald Faison said something about, if I'm going to have mint, I'll just spread toothpaste on a whatchamacallit bar and go to town on that bad boy. Like, yeah, who really wants minty? I'm just going to stick with chocolate or stick with the vanilla.
Vanilla, yeah. Oh, there's something like a good vanilla cone.
Vanilla. Oh, yeah.
Good
so
vanilla
creamy
cone.
and sweet. All right, now we got to go out for ice cream, Tracy.
Yeah. That's like my favorite dessert is ice cream. Oh, man. Yeah. I could do ice cream every night.
I know. We could.
I do. I love ice cream.
Well, Michigan's known for its cherry pie, too.
Oh, yeah. Cherry Festival will be happening soon.
Yeah, that's
this
right.
weekend, isn't it? Or next weekend?
Next weekend. Yeah.
Oh, gosh. What a great interview, Terry. It's just been a pleasure to get to know you, and your work is so important in healthcare today. And is there any thing that you'd want to share with our listeners before we wrap up today?
Well, probably, I just want to say one of my favorite quotes when it comes to performance and setting goals. It's from Charles F. Kettering, and he said, high achievement takes place in the framework of high expectations. And so, when you are setting goals, of course, you want them to be realistic, but you also want them to be aspirational because, given the right framework, you can achieve them.
Yeah,
for sure.
That's great. That's great.
What a great quote.
And where can our listeners find you? If they're listening to you, if they want to hunt Terry down, where do they go?
Well, the first thing that they shouldn't do is add a U to shoulder.
I know.
Yeah, so no U in shoulder. SHOLDER. So yeah, Shoulder Health. We're on Facebook, LinkedIn, Instagram. So if you can pull yourself away from the Taylor Swift, Travis Kelce videos on Instagram, might find us.
You might, huh? You might. All right. And where do they get your book?
All major retailers. So Barnes & Noble, Amazon. And I don't have it. I don't have an audiobook yet. I still haven't just ventured into it. I just haven't taken the time to do it. But you can get ebook and print version.
Oh, okay, great.
Awesome. Wonderful. Well, thank you, Terry, and thank you to all of our listeners that are joining us on this podcast episode. We really appreciate you. And if you enjoyed today's conversation, share it with a friend, because that is how people find us, is just when you share it with others. And if you don't subscribe to our podcast, please take a minute to do that. And of course, Tracy and I love your reviews. So go to Apple Podcasts and write a review for us. And if you like watching us on video, subscribe to our YouTube channel at Missing Logic. So
yeah, you can leave comments there too.
Yes. Type away. So until next time, stay safe and healthy, and we'll see you in the next episode.